the Lean Institute's Professor Norman Faull is spearheading what he terms the preposterous plan, which is to introduce lean management into governments in South Africa. His first project that he's really focusing on is with the Gauteng Department of Health. Norman, what progress have you made there, and what are your key findings and key points of achievement there to date?
Matthew, thank you. We started on the ground on the 1st of December, but we did go through about a month of preparation with a cohort of 22 people drawn from 4 of the hospitals, pretty big places, plus 2 people from district and provincial staff, and went through the preparation phase, including a 2-day introduction for the staff of the hospital that started on the 1st of December, and then 1st to the 5th of December, 3 projects were initiated. We call them model lines in the sense that you learn from the model. And all 4 of the hospitals in the current tranche, or what we call a cohort, will do the same 3 projects. So it's very much looking at the outpatient journey. The patient arrives, has to queue, wait for their folder, pay at a cashier, and then go to the clinic. So that's the first part of the journey. Then we're looking at the medical outpatient clinic and their journey through that. And then finally they will go to the pharmacy, queue, and wait for their medication. So those are the 3 journeys we're looking at. We initiated the first hospital in December, second hospital in the middle of, what was 3 weeks ago this week. 2 weeks' time, the third hospital will have its 5-day event. So 6 model lines have been launched, 3 of them showing really good results right from the start, 2 of them showing results but are dependent on doctors. And one of the 6 has been really interesting. You always learn most from your failures.
I've heard you say that before, actually, yes.
And it's been fascinating. It was within the pharmacy, and certainly as far as I could see, their current method is really exhausting. The staff are just working all the time in a big mush of work.
But I think we feel like that in many cases in South Africa, and I mean this is a microcosm of it that you're focusing on.
Yeah, and large number of patients waiting, and through the glass the patients can see the pharmacy staff working to collect the medication together, write them up, label the boxes, finally they get issued. And a tannoy system that has to be used to call the patients because it's an hour or more since they handed in their folder. So when we always do a kind of current state or current condition analysis in the 5-day workshop. The first 2 days are really just trying to appreciate how the work currently gets done. Then identifying the waste and the delays, because all 3 of these projects are about delays and waiting time. And then exploring with the team, and we're working with these 20 people from the 4 hospitals. So 1/3 of them would be working on this particular model line. They talk to the staff. They, in this case, the CEO of the hospital actually called the pharmacy staff together on block, 7 o'clock on the Thursday morning, said, you know, this is what we plan to do, we really need your cooperation. There were good questions put to the CEO, and away they went. And it didn't really work. In one sense, I've never seen the preparation being so good.
Yeah.
And the staff really just sort of grudgingly complied, but there was no enthusiasm, which is what we usually see.
Yeah.
And so we've started along, and I think the two really interesting bits of feedback we've had from staff is one saying, and this is a huge lesson for me and for my team, and it's one probably that we'll have to relearn because one just doesn't get it sometimes. You get so enthusiastic about something. They said, you know, we've done a lot of things to improve this pharmacy, and no one's acknowledged it. You just came in as if the place was a mess and you were going to fix it. No acknowledgement that years ago it used to be a lot worse and we made it a lot better. And we resent that. I can really understand that.
Yeah, exactly.
And the other comment I couldn't understand all that well, but it was, you didn't consult us enough. So, well, you know, as far as I can see, we consulted you more than we've ever consulted anybody else. But there's truth in it as well. It was the first of the hospitals we went to. The cohort of 22 people, it was their first time. So they are a bit like, you know, the rabbit with the oncoming car. So they themselves are a bit bewildered at what they're doing and not sure of anything really. I mean, I've been in that position myself. And so lots of things where we thought we were consulting, I can understand with hindsight that the staff working there said, oh, these people don't care about us, they don't care what we think.
Another government idea getting steamrolled to change our lives.
So last week Friday, there was a rethink of that. The CEO was involved, facilitators were involved, the staff was involved, the management was involved. There was a chance to talk through the whole thing, and we're doing what we say, that we ask for permission to run an experiment. We don't ask people to believe that what we're trying will work.
Yeah.
We ask for permission to run an experiment, saying, if it doesn't work, we'll go back to your old method. So we're going to do that. Now, I've never done that before in any other model line, and I've probably worked in over 100. So this is a wonderful new experience, and I'm really confident that this time around we'll do our homework better. There were a number of aspects of the implementation that we really just didn't do well for a range of reasons. We're going to put it back to the original status, but we will continue to develop what we call a daily management system, which is the heart of the long-term sustaining action. So that's been agreed to, measuring things like, when did you serve the first patient? How many patients did you service in the first hour, in the second hour, etc. So there's a documenting of the factual operation, and we'll do a number of tidying up and preparation things, and then there's agreement that on the 4th of March, the entire pharmacy, we were only working with part of it, the entire pharmacy will convert to the newly derived system, and I'm very excited. I think it's going to be great for the staff, and it's going to be great for the patients.